moms-to-be, check this out. If you're pregnant, you already know the back pain, the headaches, the random hip twinges at 3 a.m. It's a lot. And when those aches hit, it's only natural to reach for something in the medicine cabinet to get a little relief and keep moving through your day. But what if one of those common pain relievers was quietly linked to a much bigger problem? This team of researchers tracked pregnant moms, scanned their babies' placentas, and followed their kids for over a decade. What they found was shocking. And if you're expecting, this is something you'll want to know about. But we're not just here to drop scary stats. We're also going to walk you through what this means and give you smart, practical ways to protect your baby, starting now. So stick around until the end, because this information could make a real difference in your child's future. The study was led by Dr. Brennan Baker with researchers from the University of Washington, UCSF Columbia, and Mount Sinai. They followed 307 African-American mother-child pairs from Tennessee, collecting blood samples during the second trimester and saving each baby's placenta at birth. Then, years later, they checked the children's medical records and school reports to see who was diagnosed with ADHD. And here's what they found. If acetaminophen, the active ingredient in Tylenol and most other over-the-counter pain meds, was detectable in a mother's blood during pregnancy, the child was over 3 times more likely to be diagnosed with ADHD. That means even low casual use that showed up in the blood was linked to a 215% increase in risk. The researchers weren't measuring how much was taken, just whether any trace of it could be found during the second trimester. And it didn't stop there. The baby's placentas showed major differences too. In girls, a gene called IGHG1, kind of like a cellular antenna, was turned way up. That gene alone explained about 5% of the link between acetaminophen and ADHD, and across the board, the placenta's energy-producing genes were dialed down. That matters, because the placenta is how a baby gets oxygen and nutrients during development. This doesn't prove that acetaminophen causes ADHD, but it does show a powerful association and a clear biological pathway that could explain how. So what should you do if you're pregnant and in pain? Here's what the researchers and doctors recommend. 1. Use acetaminophen sparingly. Take the lowest dose for the shortest time possible. Always run it by your OB or midwife first. 2nd, try non-medicine options. Gentle stretching, prenatal yoga, cool compresses. These can ease aches without drugs. 3, keep a bump medication log track what you take, when, and why. It helps your care team make informed decisions. 4, know your fever plan. Fever can also harm the baby. If acetaminophen is needed, follow your provider's exact instructions. No guesswork. 5, ask about alternatives. Some OBs allow magnesium, heat packs, or physical therapy for pain, but you have to ask. 6, support placental health. Eat well, attend every prenatal checkup, manage infections. That keeps the placenta strong, your baby's lifeline. 7, flag medication, history, post-birth. If you needed regular acetaminophen during pregnancy, tell your child's pediatrician so they can monitor milestones more closely. 8, stay informed, not alarmed. This study shows correlation, not proof. The goal is informed choices, not panic. Because growing a baby comes with aches, pains, and decisions. But the more you know, the better you can protect their future. To read the full study, the link's in the description below. And if you want more research-backed insights to protect your child's health from day one, subscribe to this channel. We turn cutting-edge science into confident parenting, one study at a time.